Hello, my name is Dr. Shahedal Bari and I'm the Executive Medical Director for University Hospital of Morecambe NHS Trust. And today is the 23rd of June and here is my update. I'm going to talk about COVID numbers, vaccination and some other issues. As you may know, the UK government, and especially in England, the lockdown has been extended till July the 19th at level 3. And at present, across UK, we have got more than 200 patients in intensive care beds with COVID. Our local number is under 10. However, within the region, especially in the northwest, there has been a significant rise in the ITU bed occupancy with COVID patients. Unfortunately, over the last 1 year or more, we have lost more than 150,000 patients with COVID, and in our trust, we have lost around 605 patients. My sincere condolences to all those families who have lost their nearer and dearer person in this pandemic, but we are working hard to go forward and prevent further deaths. One of the important things I would like all of you to encourage to take up the vaccination to prevent the disease. It's a good news that more than 80% of the UK adult population has been vaccinated with first dose and more than 60% of the adult population has been vaccinated for the second dose. However, there are concerns about the Delta variant and whether this vaccine will completely prevent having infections. The evidence so far suggests that having vaccination stops people falling ill significantly, reduce hospital admission and also reduce ITU admission. Hence, it saves lives, though one may have some flu-like illness if they get infected even after vaccination. So it is absolutely important that we all abide by the rules of social distancing, using mask, using the space and using our hand gel while we are out and about, and comply with the government restriction rules to defeat this disease and the virus. More importantly, please do take up if you have got offer for vaccination. The team in primary care, secondary care, community care and across the patch are working really hard to get as much vaccination as possible. In our local area, within the hospital portal, we have vaccinated more than 100,000 people, which is a big achievement. At the same time, the work is ongoing to vaccinate as many people as we can. You would also know that we are encouraging people to have self-testing and PCR testing if you have any symptoms, or also if you're asymptomatic, to certain groups who have been provided with lateral flow tests. So do test yourself and report it through the NHS portal and the app as quickly as possible to get a PCR test so that we can isolate people and the track and trace can do their job to limit the infection expansion. It is important to recognize that the number of people in hospital beds are quite high, our occupancy is quite high, and because of the pandemic and also the infection is around, we are strict in the visiting policy and we are allowing only one person to visit at one time. Each hospital has got their own visiting policy, and please do follow and encourage your colleagues and staff to ensure everybody is following the correct policy about visiting. We would like to help out everybody's near and dear person to communicate to them about their condition, and we'll try our best about communications to the family. To prevent infection, it is important for the hospital staff to ensure we follow our PPE policy. It is summertime, so there are days when it is quite hot. So be mindful that wearing a mask or PPE for a long time can exhaust you. So do change your PPE or mask every 2 hours or as you feel appropriate to be comfortable. We have got enough supply of PPE to ensure everybody gets their support while they're looking after the patient. One of the other important points I would like to mention is about the work we are doing on BAME colleagues and the BAME network. As you would know, yesterday was the Windrush Day, and over the last 1 year we have learned quite a lot about how different, unequal our system is in providing support to offer the BAME colleagues and people the best opportunity to shine in their life. Our hospital and our trust, we have got a BAME network and BAME ambassador Mr. Amit Kocher. The network is also led by Hannah Singh. She's doing a fantastic job in making sure everybody can reach out. We have got more than 300 members of the team who we can reach out through our intranet portal or through phone or email for support. And let's be a much more fairer, equal society to offer the best for everybody. Lastly, thank you all for your hard work in hospital and out of hospital. Let's fight together to defeat this pandemic. Thank you.